Have you ever considered what's truly in the pills you take daily? Most of us trust our prescribed medications are safe, but what if some of the most common drugs could be harming our brains? Surprisingly, several widely used medications might increase the risk of dementia. This isn't just speculation. There's an expanding body of research linking certain drugs to cognitive decline. We're not talking about obscure medications. These are drugs millions take daily for common conditions like allergies, depression, and heartburn. The idea that everyday medications could lead to dementia is unsettling, challenging our assumption that approved drugs are entirely safe. The human body is complex, and even beneficial medications can have unintended consequences, especially with long-term use. In today's discussion, we'll explore 7 common medications that could potentially lead to dementia. Is there truth to this, or is it just a myth? What is the scientific basis for these claims? Stay tuned to discover if any medications you regularly take are on this list. Before we get started, don't forget to like, subscribe, and share this with your loved ones. What medications do you take daily? Share your experiences in the comments below. Currently, over 55 million people worldwide have dementia, with 60% of them living in low and middle-income countries. Nearly 10 million new cases are diagnosed each year. Dementia can result from various diseases and brain injuries, with Alzheimer's being the leading cause, responsible for 60–70% of cases. It impacts thinking, memory, mood, and daily activities. Some medications can increase this risk. So, which drugs should we be cautious about? Anticholinergics. These drugs are major offenders, blocking acetylcholine, a neurotransmitter vital for memory and learning. They treat conditions like overactive bladder, Parkinson's disease, and allergies. Common anticholinergics include diphenhydramine, Benadryl, oxybutynin, ditropan, and paroxetine, Paxil. Studies show regular use of these drugs can significantly raise dementia risk, with daily use over 3 years increasing the risk by about 50%. This is a substantial impact from medications many consider harmless. Proton pump inhibitors, PPIs, these heartburn medications, such as omeprazole, Prilosec, and esomeprazole, Nexium, are also linked to dementia. While the connection isn't as strong as with anticholinergics, studies indicate a potential association. One study of over 70,000 people found regular PPI users had a 44% higher risk of dementia compared to non-users. The link might be due to PPIs causing vitamin B12 deficiency, which is known to lead to cognitive issues. PPIs might also increase the production of beta-amyloid, a protein associated with Alzheimer's. Benzodiazepines. Anti-anxiety medications like alprazolam, Xanax, and diazepam, Valium, are effective short-term but pose risks with long-term use. Research shows regular benzodiazepine users have a higher risk of dementia. For instance, those who used these drugs for 36 months had a 32% increased risk of Alzheimer's, and over 6 months of use saw an 84% higher risk. Benzodiazepines affect memory and cognitive function in the short term, potentially leading to more permanent changes with prolonged use. Corticosteroids. Commonly known as glucocorticoids or steroids, these medications treat various conditions like asthma and arthritis. While effective, they come with numerous side effects, including cognitive problems. Research from the Netherlands shows that long-term steroid use can cause structural changes in the brain, increasing dementia risk, particularly in those aged 50–60. The risk grows with higher doses and longer use, though short-term courses for issues like asthma flare-ups are less concerning. Antidepressants. Tricyclic antidepressants, in particular, have been associated with an increased risk of dementia. These drugs alter neurotransmitter levels in the brain, affecting cognitive function. Studies highlight that certain antidepressants, especially those deemed potentially inappropriate medications, PIMs, like amitriptyline and imipramine, may heighten dementia risk. While depression itself is a risk factor for dementia, some of this association could be due to the medications rather than the condition. Antihistamines. Older antihistamines like diphenhydramine, Benadryl, also pose a dementia risk due to their anticholinergic effects. Studies suggest that frequent and prolonged use of these medications could increase the risk of dementia. However, Newer antihistamines like loratadine, Claritin, and cetirizine, Zyrtec, appear to be safer for long-term use. Opioids. Commonly prescribed for pain, opioids have also been linked to cognitive decline. A study in South Korea found a 15% higher risk of dementia among opioid users, with a significant impact seen in individuals aged 75-80. While chronic pain itself can affect cognitive function, long-term opioid use adds another layer of risk. What does this mean for us? Should we stop taking these medications? Not necessarily. Many of these drugs are essential for treating serious conditions, and the risks of not treating issues like depression or chronic pain may outweigh the cognitive risks. However, this information should encourage us to use these drugs more cautiously. Here are some key takeaways. Avoid unnecessary medications. If you can manage your symptoms without medication, that's often the best route. Use the lowest effective dose. Work with your doctor to find the minimal dose that manages your symptoms effectively. Consider alternatives. Non-drug treatments, like cognitive behavioral therapy for anxiety, may be effective and safer long-term. Be aware of anticholinergic burden. The effects of multiple medications can add up, so it's essential to keep track of your total intake. Don't stop medications abruptly. Always consult your doctor before making any changes to your medication routine. Regularly review your medications. As we age, our bodies process drugs differently, so periodic reviews with your doctor can ensure you're on the most appropriate treatment. In summary, while it's important not to be alarmed, we should remain informed and proactive about our medication choices. By being aware of the potential cognitive risks, we can make better decisions for our brain health and overall well-being. If you found this information helpful, please subscribe, like and share it to help others. Take care of your brain, and thanks for watching.